osteogenic sarcoma. Then there is some secondary osteosarcoma, like due to prolonged radiation, there is some osteosarcoma, or from Paget disease, there is chance of osteosarcoma. And some there is small cell variety also. Most commonly affect the proximal tibia and distal femur. Proximal radius is proximal humerus is also affected. Now, in case of surface osteosarcoma, this is actually low grade. There are two varieties. One is periosteal osteosarcoma, one is paroosteal osteosarcoma. We have to remember this paroosteal osteogenic sarcoma. It is associated with ring chromosome. Is a MCQ. It associated paroosteal osteosarcoma associated with ring chromosome. Now, most commonly it is found in the female and commonly found in the distal femur in the posterior aspect. Distal femur, posterior aspect. And this type of paroosteal osteosarcoma, still it is a osteosarcoma, it do not need any chemotherapy. Only operation is sufficient. So it has a very good prognostic value. So paroosteal osteosarcoma is a low grade surface osteosarcoma found in the distal femur, posterior aspect. In the case of female age group, only operation is needed, no chemotherapy. But all this type of osteosarcoma need highly intensity chemotherapy. Now, some case is called extraskeletal osteosarcoma. It can involve the soft tissue. This is always high grade, and surgical excision is the treatment of choice after chemotherapy. So, that regarding the treatment of osteosarcoma is, first we have to go for metastatic workup. Metastatic workup. What is metastatic workup? We most commonly this osteosarcoma metastasis to the lung, then bone. So for lung we can go for simple X-ray, but simple X-ray cannot diagnose the metastasis early. So we can go for HRCT thorax, which is help to diagnose. Even subcentric metastasis can be diagnosis done by the HRCT. Now for bone metastasis we have to see bone scan. But in case of child, bone scan technetium-99 metastable isotope is used. But bone scan is highly toxic or renal deficient patient or in very child age group. So we can use a new technique called PET scan. Whole body PET scan is also used for whole workup. But for as a routine protocol, we have to go for lung, then bone, and then we have to go for USG also, whole abdomen also. But lung and bone is necessary before going further. Now biopsy. Then we have to go for biopsy. After that biopsy, when it is confirmed, then what we can do? We can do, first we have to put that patient on two type of treatment protocol. First, curative intent treatment of osteosarcoma. And one is palliative intent. When patient can be treated and can be treated fully, this is called curative intent. There is no metastasis, but multiple mets we can treat as a palliative. Palliative means only care of symptomatic management, and sometimes chemotherapy also used, but in the low dose. The main motto of this palliative treatment is to increase quality of life. quality of life and how a painless life, nothing more. But when we going to do it curative intent, then first we have to go for neoadjuvant chemotherapy. 4 cycle of neoadjuvant chemotherapy, we have to wait for 3 weeks for blood count normalization. After that, we have to go for limb salvage operation, where we can do wide local excision. What do you mean by wide local excision? Suppose there is a bone tumor and we have to excise this tumor. We have to go beyond at least a healthy margin. Then we have to cut this whole tumor mass along the biopsy scar. Then we have to reconstruct it by multiple options. This is called wide local excision. Now after that, we have to put it again on adjuvant chemotherapy. Then the treatment and physiotherapy will start. So this is the as a whole swelling like this. This is a broad base, and in case of peterangular variety there is short base, and sometimes we also get multiple hereditary exostosis. This is an important topic because it has three important points. One is dwarfism, second is hereditary, third is multiple periarticular involvement. Multiple periarticular means around the joint there is multiple periarticular involvement in case of hereditary multiple exostosis. And this exostosis most commonly associated with EXT gene. This is a gene. Generally it has 3 variety, one EXT1, EXT2, EXT3, and this is located in the 19 chromosome 19. Now for every benign osteochondroma or benign exostosis bone tumor patient mainly present with swelling only. There is no history of pain as such, and this is a long history, very long history, and we can easily palpate the bony swelling. But one thing you have to keep in mind, this bony swelling is covered by a cartilaginous cap, as well as there is some muscle, there's deep fossa, soft tissue, then fat, then skin. So when this will appears in the X-ray, that will be very smaller, but when we will palpate it clinically, that will be more bigger. Now each and every osteochondroma cases need skeletal survey, because this may be involved in the distal femur, may be involved in the proximal tibia, but it also included in different side of the skeleton. So skeletal survey is mandatory in case of when we are dealing a case of osteochondroma. Now what are the complications? First complication is it can appear with the painful bursitis. Second is stalk fracture, and lastly but on the list is malignant transformation. It is 1 to 2% only. Now how we approach to this patient? We have a plain X-ray, and we have diagnosed the case. After that, we have go for counseling of the patient. Generally, this is benign. This has no this has no emergency. But when size is continuously increased, or the size increases after the age or skeletal maturity, or it can cause highly painful condition, or size is very bigger, then we can go for excisional biopsy. And during the biopsy, we have to cut some periosteum. So this is called extra periosteal excisional biopsy. If we don't cut some periosteum, this osteochondroma may again recur.